Hi, this is Piyush Bhargava and you're watching the labeled white blood cell scan teaching file. Let's review the protocol. So labeled white blood cell scans are commonly performed to evaluate patients for active infection. The radiopharmaceutical used is 500 microcuries of indium labeled white blood cells. Indium-111 has two photopeaks, 174 and 247 keVs, and it has a physical half-life of 67 hours. We typically use a medium energy collimator to image these patients who have been injected with indium labeled white blood cells. After the radiopharmaceutical injection, we wait for 24 hours and we acquire whole body images in anterior and posterior projections. When we see anything abnormal that needs to be evaluated further, then we acquire spot views, a SPECT or a SPECT CT. The mechanism of uptake of labeled white blood cells include diapedesis and chemotaxis to the site of active infection. Physiologic uptake is seen in the spleen, which is more intense than the liver, and there is mild bone marrow activity on the whole body images. The critical organ for this radiopharmaceutical is the spleen. Case number 1 shows anterior on the left and posterior whole body images from an indium labeled white blood cell scan. Here on the posterior image you can see that the spleen is more intense than the liver. They both show uniform uptake and there is mild bone marrow activity. There is no focal abnormal uptake of indium labeled white blood cells to suggest presence of active infection. Case number 2 shows spot views of the abdomen and pelvis in anterior, posterior, right lateral and left lateral projections. In addition to physiologic uptake in the spleen, liver and bone marrow, we see a round focus of abnormal accumulation of indium labeled white blood cells located anteriorly in the pelvis in the left lower quadrant. This was later found to be a site of active infection or abscess formation. Another abnormal indium labeled white blood cell scan on case number 3. On the left we have anterior and posterior whole body images. We see uptake in the spleen, liver and bone marrow. Just inferior to the spleen there is a ring-shaped focus of uptake in the left upper quadrant of the abdomen, and this was thought to be abnormal and it was further evaluated with SPECT CT. On the right we have a panel of 4 images from the SPECT CT. The top left image is a CT image in soft tissue window. The top right image is the SPECT image showing the abnormal focus being anterior to the spleen. The bottom left image is the SPECT CT fused transaxial image. And on the bottom right, we have another transaxial image. So the focus of abnormal accumulation of white blood cells seen here corresponds to an abnormal density. The CT that was acquired as a part of the SPECT CT was non-contrast enhanced. You can see there is no contrast in the aorta or the IVC. There is no enhancement of solid organs. So we cannot evaluate this focus better on this CT, but this patient had a contrast enhanced CT of the abdomen and pelvis, which showed an abscess formation in the left upper quadrant secondary to diverticulitis. Case number 4 is showing another abnormal indium labeled white blood cell scan with whole body images in anterior and posterior projections on the left. There is a large focus of abnormal accumulation of indium labeled white blood cells extending from the left thigh all the way into the knee. There is another focus more distally. The rest of the scan shows physiologic activity, spleen, liver, and the bone marrow. This focus in the lower extremity was further evaluated with a SPECT CT. On the right, we have 4 images showing the SPECT CT acquisition. Patient has a prosthesis in the right femur. The prosthesis has abnormal fluid density in the anterolateral aspect of it with a small air fluid level. This finding is very specific for abscess formation, and on the corresponding fused PET-CT image there is intense accumulation of indium labeled white blood cells in that abscess. The abscess extends from the proximal thigh all the way down to the prosthesis. They also have as a part of this prosthesis a knee prosthesis as well, and there is infection all the way around the prosthesis. So labeled white blood cell scan identified active infection and localized it to the abscess around the right femoral prosthesis. So those are some of the patterns that you can encounter when you are reading the indium labeled white blood cells. There is another teaching file, which is the 3-phase bone scan teaching file, where indium labeled white blood cell scans are also elaborated, because when we do a 3-phase bone scan, typically we follow them up with a white blood cell scan and sometimes even a technetium-99m sulfur colloid bone marrow study. So make sure you watch that teaching file also to get more information on indium labeled white blood cells. Thanks for watching.